Okay, so what we discussed is the osmotic. We discussed about the different forces like osmotic pressure, hydrostatic pressure, electrical gradient and chemical gradient. These are causing movement of the ions as well as water, right? For water we use two type of forces, osmotic forces and or oncotic forces and hydrostatic forces. For ionic movement there is across the cell especially, right? Across the cell membrane there is electrical gradient and chemical gradient. So two together we say electrochemical gradient. So plasma membranes are free permeable to water. Osmotic concentration difference between intracellular and extracellular fluid cannot be sustained. If there is more difference, osmotic difference, what will happen? There is movement of the water, either cell swelling takes place or cell shrinking takes place, right? Both are hazardous to us. So there is equilibrium is maintained in our body. Generally all body fluids have same osmolarity, around 285 milliosmol per liter, remember, right? This is all are equal, that's why net movement is 0. So if a cell is deprived of energy source, what will happen? Thus losing its ability to run ATP dependent sodium potassium pump. How would the cell size and intracellular concentration change? What will happen? If this sodium potassium pump is not working, cell is deprived of energy. What type of change is happening? Mavi, you look sleepy. Latif? Yeah. What is happening? What will happen? If you are blocking sodium potassium ATPase, what will happen to the cell? Sodium is going inside, that is causing osmotically active. More water is retaining, cell swelling takes place, right? It will cause cell swelling and bursting of the cell. So individual with hypertension means blood pressure is high. Blood pressure is high means more filtration, right? May have marked elevation in their systemic blood pressure, yet do not necessarily develop edema. There must be more water is going and retaining interstitial fluid, increase in the interstitial fluid because of more water is filtered there. That should cause edema. But individual with a small change in pulmonary capillary pressure, say from left ventricle failure. So generally what happens when this is coming, more water is filtered, what will happen? That is causing edema. If it is retaining there, increase in the interstitial fluid, right, is called edema normally. So if more filtration, what will happen? We have lymphatics. Lymphatics are taking care. They will bring the extra thing from there. Blindly lymphatics starts and they will bring extra fluid which is filtered, as well as some proteins are also filtered. They are coming again into the circulation. However, individual with a small change in pulmonary capillary pressure, right, say from left ventricle failure, quickly go into the pulmonary edema. Can you provide a physiological explanation for these different effects of change in hydrostatic pressure? What happens in the other side, into the lungs, when pressure is high, it will cause edema, but normally here it is not causing edema. Right?
I have a question.
Yes.
You said what causes edema is when they increase in intercession.
This is showing the our body fluid compartments. Larger one is intracellular or extracellular? Which one is larger compartment? Intracellular is, remember, 2/3, 1/3 is extracellular. So yellow color indicating extracellular. This is for the person having 70 kg body weight. 60% of the body weight is water. So 42 liter here. And almost normally in an average, osmolarity is how much for every compartment? Intracellular, extracellular, 300. Right? Normal state. 28 liter is intracellular, 14 liter is extracellular. This is the for normal. Right? Now, effect of adding saline solution to the extracellular fluid. When someone is infused with the extracellular fluid, right? Saline means isotonic solution containing sodium. When infused, the sodium is infused. Where it is infused? It is infused into the veins, means plasma. When plasma, you are infusing isotonic fluid, sodium and water, both are permeable to the capillary membrane. Right? Listen carefully, Jed. So what happens? When pressure increasing, more water will go, more sodium will go. So that will increase, first it will increase the volume of plasma. Right? Then it will go into the interstitial fluid because of high pressure. When you are increasing volume, what will happen? Hydrostatic pressure more. Hydrostatic pressure more means it will distribute into the interstitial fluid also. From interstitial fluid, does it go into the intracellular fluid? Sodium is not going. Right? Isotonic. So it will increase only extracellular fluid. Look here. Add isotonic sodium chloride. What will be happening here? Isotonic means no change into the osmolality. Right? But there is a volume expansion. Expansion of the which volume? Extracellular fluid one. You don't note the mechanism. So increase in the extracellular fluid. Sodium chloride constant and remain into the extracellular fluid because this is representing which membrane? Which membrane is delineating, partitioning intracellular and extracellular? Cell membrane, right? So cell membrane is not permeable to sodium and chloride. So they will be remaining into the extracellular. Right? Now another condition, effect of adding hypertonic solution to the extracellular fluid. Follow. If someone is going into the ocean, right? He doesn't have other option. He or she is drinking salt water. That is highly salty, right? 0.9% is isotonic, but salt, I think they contain 5-6%, right? Salt in the ocean. So when you adding hypertonic solution, means more, then what will happen? That is, right? That will increase the osmolality. Osmolality will increase, but when osmolality increasing into the, you are adding in where? Extracellular fluid, right? So more salt added, what will happen? Osmolality increasing. When it become hypertonic in comparison to the cell, what will happen to the water? Where it will move? You are adding in the extracellular. Only salt, suppose adding. Salt added there. It become more salty. It become more hypertonic. Extracellular become hypertonic. Intracellular is hypotonic now, we can say. Right? So what will happen to the water? Move from
the compartment.
Intracellular to extracellular. There is two compartments. It is going from intracellular to extracellular. So cell will shrink. Same thing, na? Cell will shrink. Like you are putting cells are in the hypertonic, what will happen? Cellular water will go outside, right? Cell shrink. So here cell shrinking, it is showing here, cell is getting shrink and water is going into the extracellular, right? So first it become diluted. So extracellular osmolarity increases. Osmosis of water out of the cell and into the extracellular compartment, right? So both osmolarity increases, right? If water is moving, first it is 300. When water is moving, what will happen? It become more than 300. Are you getting it? This one is outside is also already high. So increase in extracellular fluid volume, decrease in intracellular fluid volume, right? Increase in osmolarity in both the compartment, right? Both the compartment. Suppose here it is 300, you are putting 50, it become 350. And what is the osmolarity here? Normally in the cell, how much is the osmolarity? Yes, cellular osmolarity how much? Yes, 285. So it will move water. So it become 300 more, both become equal, right? Somewhere. So both osmolarity increasing and volume here decreasing, here it is increasing. Decrease in intracellular fluid volume, increase in osmolarity in both the compartments, increase in extracellular fluid volume. Effect of adding hypotonic solution to the ESF. Now brain wash, right? Brain storming. Effect of adding hypotonic solution to the extracellular fluid. You are drinking water, right? This water is absorbed, first going into the extracellular fluid. What will happen? They are getting diluted, right? They are getting diluted. Volume will expand, right? They are getting diluted. Volume will expand here. So when volume expansion dilute, it is getting diluted, right? So osmolarity of the extracellular fluid decreasing because it is getting diluted, right? Then water diffuses into the cell from dilute to the concentrated until the intracellular and extracellular compartment have same osmolarity, right? To maintain the equilibrium. So when water is going there, what will happen? Water is going means osmolarity will go down, right? So both their volume will increase, right? Both volume will increase, osmolarity will decrease or increase. What? What happens in this situation to osmolarity? Increase, decrease, which one will increase, which one will decrease? You are drinking water. It is already 285 in both compartment, right? Suppose you are drinking 1 liter. You have 4 liter plasma. So it becomes 5 liter. How much total osmolar there? Suppose 300. 300 means 300 in 1 liter. So 4 liter how much? 1200. Now 4 liter it become 5 liter. So 5 liter 1200 means now it is less, right? So when hypotonic solution, extracellular become hypotonic, intracellular become hypertonic in this situation. Then what will happen? Water will go from extracellular to intracellular, right? So both volume will increase and both are getting diluted. Both are getting diluted, right? You have to do, this is very, very important, and definitely you will get all the USMLE exams, NBME, you will get this question. This figure they will give and you have to explain, right? It is a very confusing thing. So you have to make a clear concept. So look here, intracellular, extracellular fluid volume increasing, osmolarity will decrease, right? Intracellular fluid increase greater extent. Same thing given what we discussed here in like isosmotic volume expansion it is called. Means someone is given isotonic solution, what will happen? Increase in the extracellular fluid volume here, right? Intracellular no change, extracellular osmolarity no change, but hematocrit value, you are not adding, RBC is getting diluted because you are giving the plasma, right? So it is hematocrit value will decrease. Isoosmotic volume contraction means diarrhea, you are losing extracellular fluid, so volume will decrease, volume will here, intracellular no change, extracellular osmolarity no change, you are losing isotonic solution, right? You are losing isotonic solution. So hematocrit value will be high, but sodium is no change, right? High sodium chloride intact means you are telling hypertonic solution. What will happen? Extracellular fluid volume will be, it become more concentrated, right? That will absorb the intracellular fluid volume also. So it will decrease here. Extracellular fluid volume is increasing because of they are dragging the water from intracellular. Then extracellular fluid osmolarity will increase, right? Hematocrit decrease because you are taking sodium chloride, right? Decrease in hematocrit value, it is getting more diluted. Sweating, fever, diabetes insipidus. What is diabetes insipidus? When kidney is losing more water, right? So extracellular fluid volume will decrease, right? Intracellular fluid volume will also decrease because sweating, what happens? It is losing more salt also, right? Fever, diabetes insipidus, so that will decrease the volume. Extracellular fluid osmolarity will increase. Hematocrit remaining same. Hypoosmotic volume expansion, that is syndrome of inappropriate secretion of ADH, just opposite to diabetes insipidus. More secretion of the ADH hormone, it will cause more water reabsorption, right? That will causing dilution of the extracellular fluid volume. Volume will increasing, fluid, intracellular fluid also, if it is getting diluted, what will happen? Extracellular fluid volume increasing, right? Hydrostatic pressure increases, and intracellular fluid volume will increase. Extracellular osmolarity will decrease, right? Hematocrit is remaining same. Adrenal insufficiency means salt, they cannot absorb salt. Salt absorption depends on sodium, depends on the aldosterone. So if aldosterone is not secreted, what will happen? Extracellular fluid volume will decrease, right? Salt is retaining osmotically, it is maintaining to retain the water. So less salt, less will be the volume. Intracellular, it is not going in intracellular, so it will increase because it is getting diluted and more water will go from higher to lower concentration. Extracellular fluid osmolarity decreases, right? Hematocrit is high because less water, less sodium, blood is getting more concentrated. So this figure is more important for you. Okay. So clinical abnormality of fluid volume regulation, hyponatremia and hypernatremia. Natremia is the condition for the sodium. Hyper means more accumulation, person taking more sodium. Hyponatremia, less sodium, So like in dehydration, adrenal insufficiency, overuse of diuretics, that will cause more sodium loss from the body. If sodium is lost, what will happen? Water content into extracellular fluid is decreasing, right? Then what will happen? Plasma sodium concentration decreases, extracellular fluid volume decreases, intracellular is why increasing? Is it right concept? Yes, because it is getting diluted. Less sodium into the extracellular means it is causing movement of the water from dilute to the concentrated, means intracellular side, right? So it will increase. Hyponatremia, overhydration, means we are drinking extra water more than required. What will happen? It is diluting the sodium, but volume is high, right? Sodium concentration decreasing, but volume here is more volume and diluted, so it will intracellular also increasing, right? Sometime you will be asked this question, so you have to practice, because it is very difficult for me also, right? So you have to need practice, ask yourself again and again.
Another question.
Yes.
Like
Clinical abnormality of fluid volume regulation, hyponatremia. What is the cause of hyponatremia? Like loss of sodium. One loss of sodium is less secretion of the aldosterone, adrenal insufficiency, diarrhea and vomiting, overuse of diuretics, addition disease, that is aldosterone secretion deficiency, right? Or so it will cause excess water retention, increase like ADH, increase ADH, right? Hyponatremia. So hyponatremia, that will cause dilution of the extracellular fluid. So fluid will move from the extracellular to intracellular, and that will cause cell edema, overhydration, profound effect on tissue and organ functions, especially brain, right? They are causing edema. It can cause brain cell edema and neurological symptoms including headache, nausea, lethargy, disorientation. It will change the excitability of the cell. So if plasma sodium concentration, how much is normal? 1 till 138. So when it falls below 115 or 120, right, brain swelling lead to the seizure, coma and permanent brain damage. And if not treated, that may cause death. And because if swelling there, brain box there, its volume is fixed 1500 milliliter. If swelling there, it will increase the intracranial pressure, right? So it increase volume, cannot increase volume, and about increase in 10% without it being forced down, neck herniation and permanent brain injury and death, right? Effect of slowly developing hyponatremia, what will happen? It will adapt. So it will take days, brain and tissue respond by transporting sodium, chloride, organic solids such as glutamate from the cell into the extracellular compartment, right? So how treated? Osmosis mediated demyelination of neuron, avoided by limiting the correction of chronic hyponatremia by adding less than 10 to 12 millimole of per liter of that for 24 hours. We have to infuse slowly, right? Other thing. So acute hyponatremia, that you can see here, the swelling. So go through the slide, please. These are the points we have to remember. Here I have added type of edema also for your self-study, right? What is edema? Extracellular generally edema we say, right? Intracellular edema also there, hyponatremia, depression of the metabolic symptoms of tissues, like if ATP is not provided, sodium potassium pump is blocked, it will cause swelling in the cell. Cell swelling is called intracellular edema, right? But per se only, when we say only edema means extracellular edema. So there are different type of edema. Extracellular, what causes extracellular edema? So please read, and you have still due, right? So prepare better for the, you are supposed to do SGLT and you are supposed to do the glucose, right? So do on Monday, right? You will get more time. Monday, try to present it, right? Thank you. So these are the extra slide I put here for your own study. And you will study, I think you studied in pathology about edema.